So if you have a 5-year-old or, a 10-year-old or a 15-year-old or you who, you know, if you're seeing that your brain doesn't seem to be connecting things super well, there could just be tension on it. So that's the simple solution right there. And then once that is established, that's clear, then we can go into these other things that exercise the brainstem, essentially exercise the frontal lobe. And yeah, you can backtrack and really have significant improvement.
Welcome to the Soaring Child podcast, where parents of children with ADHD learn tips and tricks to help their child soar at home, at school, and in life. We feature interviews with experts, medical professionals, and parents just like you who are learning how to reduce ADHD symptoms using food and other natural strategies. Because children with ADHD deserve to soar just like every other child. I'm Dana Kay, your host. Hello, parents. This is Dana Kay here with another edition of the Soaring Child podcast. Now, today we are diving into a topic that I actually don't know much about. So I'm actually going to be learning right beside all of you today. And my guest is going to sort of reveal an overlooked piece of the puzzle that can transform the ADHD landscape and really just provide that holistic approach when helping our kiddos thrive. Dr. Kaleb Scroggin was born and raised in Savannah, Georgia, where he currently runs his pediatric-focused chiropractic practice. He was a high-level athlete growing up, where he was exposed to sports chiropractic and even went on to working with pro athletes in the NFL and the MLB. Both my boys will be super happy to hear that because they love both sports. During his undergraduate degree and the first portion of his chiropractic schooling, he was then exposed to the profound impact of working with children and the life-changing things that can happen when a child's health is improved and restored. He's a man after my own heart. He immediately shifted from working with athletes and dove into newborn and neurodevelopmental health. From there, he received a board certification in pediatrics and published a paper on balance and coordination in children with ASD while running a practice and raising 3 beautiful children with his wife. Every day, he is invigorated with the changes he sees in children's lives. Oh my gosh, I am so excited, Dr. Kaleb Scroggin, welcome to the Soaring Child. I'm so excited to have you here.
Yeah, thanks for having me. I just went through and listened to a few of your episodes, and I really love the topics that you dive into. And I think that we had some preliminary talking before the episode where I was actually thinking we potentially might not be on the same wavelength. But then when I looked into the episodes, it seems like we're really going to jive well together in how our thinking and approach to helping kids with ADHD and other things of the like.
Definitely.
And yeah, so super happy to be on.
Yeah, look, for me, it is about what are the pieces of the puzzle that can help our children with these neurodevelopmental disorders, what can help them thrive. There's not one thing that's going to help them thrive. And yes, they can thrive naturally, but we want to make sure that we have all of those amazing ingredients to really, really help them thrive. Now, can you just start by explaining? So, listeners, what we're going to be talking about today is primitive reflexes. Again, as I said, not a topic that I know much about. And so I'm so glad that you're here. Can you just start by explaining for the listeners what primitive reflexes are and what their significance in early childhood development is?
So I teach this topic to other doctors, and so I'm used to teaching it at a little bit more nuanced level. And so what I'm going to try to do today is bring it down to concepts so that it's really easy to understand. And essentially, when you're a new person, right, a baby in utero, you don't really know what to do yet as far as movements. you don't know that your hand is a hand. You don't know innately you don't know how to snap your fingers. You don't know how to do these things. The brain synapses haven't been created yet in your brain. And so when you're very young, it's about primitive reflexes are the major movers of your body from about 4 months pre-birth to about 4 months after birth. And their goal is to actually train the rest of your brain on what to do. So it's like the downloaded software for the movements that you need to make when this stimuli happens. And so when you have a newborn baby, you put your finger in their hand, their hand grabs your finger. They're not saying, oh, that's a cool finger, let me grab it. You're touching a part of their body, and it's a reflex. And there's about 14 different reflexes, infant reflexes or primitive reflexes, whatever you want to call them, that we check in our office on our new infant exams that should be there at birth. And there's various different goals for each individual reflex, but as a whole, it really is teaching the rest of your brain what to do. So as you develop, because you can't talk about infant reflexes or primitive reflexes without talking about two things: the brainstem and then developmental milestones. They're all together. And so when we talk about that infant development, all of these reflexes come from the brainstem. You've done a lot of work with ADHD, so I imagine you've heard about the vagus nerve. Okay, the vagus nerve. A lot of people talk about the vagus nerve, vagal stimulation, parasympathetic, rest and digest. Well, the vagus nerve actually, it's a nerve, just like all of the other cranial nerves, just like all of the other nerves. It's a conduit. What makes it important is where it comes from. It comes from the brainstem. And the brainstem is what houses all of that information that is, I guess, genetically put into your brain. And it's a simple way to say it. So when you're born, you have all of these triggers to do things. All right. So moving on.
If I'm understanding correctly. Okay. So primitive reflexes, and this is me dumbing it down for my brain.
Yeah.
Primitive reflexes are kind of like a downloadable software that we download at birth or download prior to birth to be able to do certain functions, like when a finger touches our hand and our hand closes. Okay, so it's this downloadable software. Am I right?
Yeah. Yes. It should be, I guess, it's already there.
Yep.
Versus needed to be downloaded. So it's already there. You don't have to learn it. It's there.
Yep.
At birth. And there are some reflexes that are there starting at 4 months before birth, some that don't come on until a few months after birth that help with different developmental milestones. Okay. So what
I hear a lot is something called retained primitive reflexes.
Yes.
So can you explain that before we sort
Absolutely.
of in with, the more technical stuff? And that would be fabulous.
Absolutely. So when we're talking about retained primitive reflexes, we have to talk about the order of development.
Yep.
So we start out as a baby. We need to have all of these reflexes because the brainstem then stimulates the rest of the brain to grow. The rest of the brain hasn't developed yet. And so it's almost how it turns on the rest of, it's the ignition switch for the rest of the brain, the frontal lobe, which is where a lot of our ADHD symptoms come from.
Yeah.
So is a dysfunction or dysregulation or miscommunication, whatever you want to call it, it's not firing exactly how people want it. Therefore, it expresses differently, right? And that could be attention issues. It could be reading. It could be eye tracking. It could be not knowing your left from your right. Sorry, go ahead.
No, that's okay. So again, to put it in the dumbed down version for myself, kind of like, I like that, okay, it's the starting software, and then the software developer will pick that up and start writing code to train the body and the brain to do all of these other things. But in ADHD, there might be a piece of that code missing, or there may be that code written in a different way. Would that be a good way to explain it?
I think so. So essentially, movement is the number one driver of brain development. That's why movement and exercise and development, especially at a young age, is so important. That's why crawling is so important. Even more important in my perspective than walking. We have a lot of kids that come in and their parents' goals are they're not walking yet. Well, when did they start crawling? Oh, last month. Okay. Well, we need to hold off on walking and let's make sure they get the crawling in, because the crawling does what we're about to talk about next is integrates primitive reflexes. So the brainstem is controlling the primitive reflexes. As your brainstem uses them and uses them and uses them, and it's teaching the rest of the brain how to then use those body parts. So let's just use the palmar reflex there. When you touch your palm, the baby grabs. Okay. Once it does that a certain amount of times, over a certain amount of time, the frontal lobe, your voluntary center, the part where you say, hey, that looks like I want to grab it, I'm going to go grab it. It teaches that part of the brain how to do it. And once it does that, it can delegate, the brainstem itself can delegate that process to a higher functioning part of the brain. And that helps that higher functioning part of the brain develop as a whole. And so there's a ton of infant reflexes that need to be integrated in order for that frontal lobe, the executive function, to have a good foundation to work. If that makes sense.
Yes.
So you have to turn on the whole frontal part of the brain in a developmental order as a baby for your adult part of the brain to work appropriately. And that's attention span. And that is decision making. It is impulse control. The number one function of your frontal lobe is impulse control. If a lizard doesn't have that, therefore anything that moves, it shifts and looks towards. But if you're trying to focus on something and there's a noise over here, that's your frontal lobe saying, that's a noise, it's not important, I'm focusing. And that is a huge thing that you have to have all the pieces for. So now let's talk about retained primitive reflexes. So when your brainstem doesn't get that repetitive reflex over a certain amount of time, and it doesn't integrate properly, which means essentially transfer from the brainstem to the frontal part of the brain. That's what the integration, a lot of people use these words. It means delegate. It delegates to a different part of the brain. If it doesn't get delegated to that part of the brain, then it stays in the brainstem and you stay with a reflex. And now, sure, I can test a bunch of reflexes and say, oh, this is a retained primitive reflex. Whenever I touch your cheek, your lip kind of quivers because it's a retained rooting reflex. That really in itself doesn't really matter much. But what it means is the brainstem didn't delegate a task to the frontal part of the brain. Therefore, the frontal part of the brain is not working all the way yet. And then you have to look at what is the 1,000 things that the frontal part of the brain needs to control, and it's doing it on 5 cylinders versus 6.
Okay, that makes sense. And so you can totally see how those primitive reflexes, are connected to ADHD because, we talk about that frontal lobe, the thing that's responsible for attention and focus and executive function and planning and organizing, all of the things that kids with ADHD struggle with. So there is a definite light there shedding, on the relationship between the two. Now, how would parents know if the brainstem hasn't delegated that primitive reflex or that task to the frontal lobe? How would they determine that?
So to get into the nitty gritty of it, you really need an evaluation. And so that could be from a pediatric trained chiropractor who focuses in neurodevelopment like me. OTs do a lot with primitive reflex integration. Functional neurologists, they're, I don't know what you would call them. You can just look up functional neurology. They're a profession, and they do it. I know that it's a franchise. It's called Brain Balance. I don't know if we're plugging other thing. I don't get any any money from them, but Brain Balance Centers, they are a full spectrum ADHD, autism, learning disorder, reading, all the kind of disconnection syndromes is kind of what they call them. They help with that, and they use a functional neurology approach. And so all of these types of people and professions can test each individual reflex and see what parts of the brain aren't firing like they're supposed to, and then come up with a plan for improving that. For me, I like to keep things very simple. There's two groups. How about that? Two groups of people. There's the babies that don't have the reflexes and should, and the kids who do have the reflexes that shouldn't. Both of them need to be corrected. And so for me, I spend a lot of my time with the babies that don't have them, that should, trying to get them back so that they can integrate properly.
So what happens? So I'd say the most people listening today would probably have the kids who have already got the ADHD symptoms, and that probably fall into that second category of, maybe they're missing some of that integration.
Yeah. So I have general guidelines that I give to everyone, regardless of how they test. And that's based off of the most common retained primitive reflexes that we see. One of which is called the spinal galant reflex. And that's essentially if you touch a kid or an adult on the back, like kind of, where people get ticklish on their side in the back, that area. If you, trying to use the right word, stroke, I guess, with your fingernail up the side of the spine kind of towards the flank, and you get a really kind of ticklish response where they curve and jolt in, that's a retained spinal galant. And that's very commonly retained. And the way that you extinguish that is crawling. And there's a therapeutic way to do it and a functional way to do it. So the therapeutic way, they call it the test is the treatment. So that same thing that you did, you run your thumbnail up their back and they curve over and say, "Ooh, that's ticklish." You really just do it over and over and over for, I tell people, maybe 30 seconds before the kid starts getting irritated that you're doing it, holding them in one place. And it might not reduce during that 30 seconds. You do the other side, and then you come back tomorrow or maybe later in the day and you do it again for 30 seconds. And then the next day you do it. And then in a couple of weeks or even a week or even 2 days, you might see a reduction in that reflex response. That means the brainstem's like, "Ooh, this thing, we're stimulating. Okay, I'm going to go ahead and delegate this to the frontal lobe." And then all of a sudden when you do it, they don't have that knee-jerk response anymore, which is amazing. It might not seem like anything on just looking at them, okay, they're not as ticklish, but what's happening is their frontal lobe is lighting up with new things that they can do. And so that's one of them. And so you can do the test as the treatment. You can do the thumbnail up the back and try to elicit that reflex over and over and over until it goes away. The other way is crawling. So you can have pillow forts. You can have them crawl under the table. You can have bear crawl races and baby crawl races and army crawl races. And a lot of times you're going to have to get on the floor with them, especially if you have one kid. If you have a couple of kids, right now I have a 5-year-old, a 3-year-old, and a 9-month-old. it's
Oh,
really
that's
easy
my
for
hat off to
me.
you. That's amazing. Yeah, it'd be very easy to practice crawling with that crew.
Yeah, it's very easy for my 5 and 3-year-old. I can say, hey, over the last couple of months, we've been teaching baby how to crawl. So why don't you go show her? Let's crawl around the house. Let's do a crawl race. And I like these general recommendations because crawling's not bad for you. So regardless if you have a retained primitive reflex or not, that's going to be good at developing the movement centers of the brain.
I love it. I love how you
Yeah.
gave that practical advice because that's what we want. I think that that seems like such a simple thing to do. I'm curious with some of the retained primitive reflexes you mentioned a little bit earlier, that impulse control. Are there specific retained primitive reflexes that control that impulse control, or is it just all of them in general, or are there specific ones that are delegating for specific tasks?
So I'm going to try not to get into too much in the weeds with nuance, but essentially what happens is all of these reflexes are controlled by the brainstem. And the brainstem wants to delegate all of these reflexes to the frontal lobe. And as a whole, they help the frontal lobe function more efficiently. So I wouldn't, if somebody has impulse control, yes, you could say that their moro reflex is most likely going to be the one that hasn't integrated. And so the moro reflex is if you tilt your head back or there's a loud noise, you have this, the baby reflex that comes like that. That's probably going to be the most likely one, but it doesn't have to be. And so what we want to do is really work on all of them and just try to get all of them working at a more optimal level. And so we did the one for Gallant. Another one that you can easily test at home is you just brush somebody's cheek. And I know this is a podcast, so I would picture drawing whiskers from the corner of your mouth. And just a super light touch. We're not pushing in. It's just kind of stroking. And what you're going to look for is kind of that cheek to that mouth to kind of twitch. And if it twitches, that's a positive. And therefore, you need to stroke and do that test as the treatment. And there's more specific things that we could do. But right now, that's for a clinician to really look at and develop a protocol. But it's the same way. You do it for 30 seconds and you do it on the other side for 30 seconds and until you see it, what they call extinguish. And extinguish just means that you don't have that response anymore. So, you have a thumb sucker. That person needs that oral stimulation. That oral stimulation is a brainstem function. That's your baby needs comfort. It needs to suckle. It needs to nurse. But when you're 5, that's not where you get your comfort from anymore. I guess in some parts of the world, maybe. Not in the US. They're trying to, I'm not going to get into other things.
No, I know where you're going with that one. And yes, I tend to go on tangents quite a lot on the podcast. And I know where you're going and agree with you. But yes. Okay. So if you are 5 and you're still searching for that, is that one where that is, there's a suckle reflex, there's a suck reflex, there's your gag reflex, there's the rooting reflex. There's all of those things. Gag reflex, because, I do find a lot of families that I work with, you've got a picky eater and some of them have that gag reflex, if they try something that they don't like, or it makes them gag. So I'm curious about that one.
So what I love about the way that we view the brain is there are millions of processes, trillions of processes that the brain does. But what's really cool is when you understand the underlying philosophy of why the brain works, it boils it down to very simple. So if a child has a reflex that shouldn't be so high, now there's obvious asterisk, there's like brain injury. We're not talking about brain injured children with concussions and things like that. It's a totally different thing, because that can also cause these, and that is not necessarily the correct way to treat that. There are exceptions, but in general, let's say we have a gag reflex. We need to look back at, as a baby, did it get integrated properly? And so we can actually continue on that thought we were just talking about, breastfeeding. And I don't know if that's what you thought I was going with that, but but when a baby breastfeeds for a prolonged period of time, they're using the reflex, and using the reflex integrates the reflex and moves that reflex into the frontal lobe, which now helps the brain develop. And so there are big benefits to breastfeeding and a lot of other things. But as far as right now, we're looking at a 5-year-old, we can't say, okay, let's start breastfeeding.
Yes.
So what we would do then is there's orofacial myofunctional therapy, which is great. I don't know if you've had any of them on your podcast. I think that would be great.
No, but I have been looking for someone to talk about it.
Yep, I have the perfect person for you. She runs like a whole. She's great, but because they're going to get into testing the reflexes and trying to integrate them, because in the mouth is a little bit harder than saying, okay, take a hairbrush to the bottom of their foot and that will help toe walking. And you're not going to be going in there gagging them all the time.
Yes.
And so really gag would be a little more advanced than just a conversation, but there are absolutely, it works the exact same way as the other reflexes. So if you have a child who's learning to eat 6, 8, 9 months, that's gagging all the time, that we need to stimulate that. Either their palate isn't structurally correct. Maybe they have a tongue tie. A tongue tie, I think, would be a good thing for this age to look at, 5 years old. If they had a released or unreleased tongue tie, that's what extinguishes that reflex, is that tongue resting comfortably on the roof of the mouth. And if it doesn't stimulate. If the roof of the mouth is up high and there's a half-inch gap between the tongue and the roof of the mouth, it's not going to get stimulated. Therefore, that reflex is not going to get integrated properly. Yeah. And then so that's where you go to speech therapy or feeding therapy, and they'll go in and rub or tell you how to rub the roof of the mouth and essentially gag them a bunch. And it'll help integrate that reflex. The other thing is taking a look at the structures of the palate and the tongue. If they need a tongue tie revision, you can do it at 5 years old. I have a friend that's 30, and she just had her tongue tie released, and that helps lower the palate, widen the teeth, and so that maybe they don't have to get braces. There's the body is so interconnected. It's hard to kind of stay on one topic without bringing in so many other topics.
Yeah. And that's the beauty of what we're doing, and the beauty of this podcast is we're trying to provide solutions that, for the whole body, because it really is about the whole body. It's about it being interconnected. And Kaleb, I have to say that, you've taught me a lot today, and I love the practical tips that you've given on some of these things. Now, what's sort of that ideal scenario for setting up, a child for success? And, is it too late if families didn't do that?
No, it's not too late. There's definitely a way to improve that brainstem function, that connection to the frontal lobe. Some of it might be structural changes. Maybe they need to get a tongue tie release. That'll help that gag reflex. Maybe they need chiropractic care which is super helpful with integrating reflexes, because that's what I do as as a brainstem specialist, is take tension, physical tension off the brainstem from either the birth process or whatever knock or fall or whatever they had. I can tell you one quick story. We had an 18-month-old come in. It was referred to us by a pediatrician. Pediatrician thought maybe there was some kind of hip misalignment or something going on with the hips, because the baby, or 18-month-old, the child, wasn't walking. And he didn't see any gross reasons why the kid shouldn't be walking. And so he sent him to me, see if maybe I could check. And he had what we call a plantar reflexor Babinski sign, is what they call it. And that's where you stroke the bottom of the foot and their toes flare up. So like this. And so that's a retained primitive reflex. It should be gone by a year. And the purpose of that reflex is to keep you from walking, because that primitive reflex goes away at around 9 months. Guess what everybody starts doing at around 9 months? Starts standing and putting more weight on their feet. Before that, there's a safeguard. There's a reflex that keeps you from wanting to put your feet on the ground. And so when that reflex is retained, you're not going to walk, or you'll toe walk, or you don't. It's just you're not wanting to put socks and shoes on. It's that sensory integration thing that I'm sure you've had on here many times. It seems like it's just ticklish or uncomfortable. There's like a sensation you can't describe. That sensation is the primitive reflex. And we found tension on his brainstem, cleared it, and I got a video. Well, after our adjustment, got a video that after our adjustment, we checked his primitive reflexes and they were gone, like they were supposed to be. Then I got a video about an hour later of him walking.
Oh my gosh, that's amazing. I love that.
Within an hour, he was walking from an adjustment to clear the tension that was on his brainstem that was probably just been there since birth, the birth process. And so we have all of these therapeutic modalities that we can do, like the crawling and the testing and the rubbing and the stroking and the tickling and all this stuff. But first, we need to make sure there's not a big, splinter in the communication process. So that's where I come in. I adjust and clear that communication, allows the brainstem to relax.
Yep. So really, you want to make the brainstem relax, but it's not too late. So if we've got an 8-year-old who's got this impulse control, it's not too late. What you're saying?
Correct. They might just have tension on their brainstem.
Yep.
This could be that simple. We see a ton of kids in our office, and I've even published that one paper on a child who was 11. So many different diagnoses. You'd have to look at the paper to even list them all. But that's all we did, was take the tension off the brainstem, and all of a sudden the lights started turning back on. And he started being able to do more things and move more clearly. And I said already, movement is the main driver of development of the brain. Mm-hmm. Movement. And so when we get that movement working properly, then the other things, the attention, the lateral eye movement, the reading, the sensory processing, all of that stuff starts working more efficiently. So if you have a 5-year-old or a 10-year-old or a 15-year-old or you who, if you're seeing that your brain doesn't seem to be connecting things super well, there could just be tension on it. So that's the simple solution right there. And then once that is established, that's clear, then we can go into these other things that exercise the brainstem, essentially exercise the frontal lobe. And you can backtrack and really have significant improvement.
Okay, well, I have to say, Kaleb, you have really just shared so much with us. It's been incredibly enlightening. It's really clear that sort of addressing these foundational aspects of that neurological development, it can play a vital role in supporting our kiddos to thrive, both at home, socially, academically. And it really just shows, the importance of looking beyond the traditional methods, exploring all of these different approaches and considering the whole child. And, like I've said a lot, it's all these little ingredients that's going to help our kids thrive. We navigate this journey as parents of kids with ADHD, and it's important to sort of remain open to all of these innovative strategies, because really this is what's going to foster their growth. It's going to foster their well-being. Kaleb, thank you so much for joining us today, and for the invaluable work that you do, because I think it's what you do and the change and the shift in your focus in helping our kiddos that have that neurodevelopmental delay is so wonderful. Please tell listeners where they can find and follow you online.
Awesome. So you can always find our socials. So Instagram, Facebook. The name of my practice, where I put most of my information out, is Restoration Chiropractic in Savannah, Georgia. And for me personally, Dr. Kaleb Scroggin. And that's pretty much it. I do a lot of education, and would love to help you out, or find someone near you that can help you out also.
Fantastic. Well, thank you once again for joining me today. Listeners, thank you for tuning into this week's episode of The Soaring Child. If you found it beneficial, please give this episode a like and a share, to share it wide and far, because we are out there letting families know that with kids with ADHD, they can soar just like any other child. I'm Dana Kay, your ADHD health practitioner. Keep on thriving. Thank you for listening to the Soaring Child podcast today. To learn more about how to help your child with ADHD soar using natural strategies, visit our website at adhdthriveinstitute.com and follow us on social media at ADHD Thrive Institute.